Good afternoon, my name is Juan Escobar and I'm here to talk about my portfolio project. This project is based on a patient that I met 2 months ago on my clinic, the clinic where I'm doing my clinical hours. Empire Medical Associates. This clinic is located in Belleville, New Jersey. This patient is a 67 years old female patient. This patient came to the clinic for her annual physical assessment, and also she came to the clinic for her follow-up on her chronic conditions. This patient is suffering from hypertension, type 2 diabetes, and hypothyroidism. This patient has been suffering from hypertension for almost 20 years. She's suffering from type 2 diabetes for almost 25 years, and she has been suffering from hypothyroidism for almost 35 years. She referred that she usually goes to see her primary care provider 3 to 4 times a year for her follow-ups. She refers that she had a C-section on 1977 when she was 25 years old. That was the time when she gave birth to her only son. And she also talked about the family medical history of importance. For example, she mentioned that her mother died when she was 30 years old in 1982. She doesn't recall the specific cause of death for her mother, but she said that her mother died from cardiac complications. And she also mentioned that her father died from lung cancer 20 years ago. For the second part of the project, I'm going to talk about some questions that I asked the patient, and I'm going to talk about the answers she gave. For example, I asked the patient if she had a healthcare proxy. She didn't know what a healthcare proxy was. I mean, she had an idea, but she didn't know the specifics and what a healthcare proxy means and what a healthcare proxy usually do. I explained to her what was a healthcare proxy and what was the importance to have one. After I explained that to her, she mentioned, or she chose her son to be her healthcare proxy. Her son is 43 years old. He lives with her and with her husband in the same house. And she mentioned that her son is a big help for them, because usually when they need, for example, to pick up something from the pharmacy or to get something from the supermarket, he is the one who helped them to get the things that they need. That was the reason she gave me, and pretty much he's the one that helped them in anything they need. How did the patient respond to my question? Well, at the beginning, she was kind of like, I don't know why you're asking me these kind of questions. They usually don't ask these kind of questions. And I explained to her that it was a part of my project, and not because it was a part of my project, also because it's needed. I mean, it's something that in the long term she will need. I explained to her, and she was like, yes. She understood after my explanation, and she was very cooperative to me. Was there a family member involved? No. She was alone in the clinic, in the room. Her son was outside waiting for her. He was outside in the waiting area. So I didn't have any interaction with her son. But she didn't want to call him in. I asked her if she wanted to call him in so we can talk about this, and she said no. I'm gonna talk to him about this later, and he will accept to be my healthcare proxy. Any barrier to complete the discussion? I don't think I had a barrier. I asked the patient let's figure this out. I'm gonna give you a lot of information, so I would like to have your son with me, and maybe we can sign the documents. The 5 wishes documentation. And she was like, no, I understand what you're saying. It's for my own good, she said, but let me just right now get the information that you're giving me. I'm giving you the name of my son as my healthcare proxy, and I'm going to talk about this in dinner time with my son and my husband, because it's something that I need to do, and something that my husband in the long term need to do also. She made like kind of like a joke. She said like, they're gonna think that that I'm dying, that I have something like a cancer or something. But she was laughing at that moment, and I was like, okay, I'm going to respect that you need more time to do that. And that's why we didn't complete any documentation that day, even though she gave me the name of her son as a healthcare proxy, and we discussed a lot of things later on. We didn't document anything because she wanted to talk first with her son and with her husband about this. I'm going to talk about intervention, barriers, patient self-determination act, living will advance directives. First of all, after the discussion with the patient, we came out with some goals, medical goals and advanced directive goals. For the medical goals, patient wanted to have like a very under control chronic conditions. For example, in hypertension, patient is usually less than 140/90. At the time of the visit, the patient was 133/87. Patient was taking lisinopril 10 milligrams every day. So she's going to continue with that medication as prescribed every day. One of her goals is to have her blood pressure around that values, less than 140/90. The patient will continue with the same medication, lisinopril, once every day. Patient will start decreasing the salt intake, because that was one of my recommendations, to decrease the salt intake, to avoid canned food. And she committed to do that. She was committed to do that later on. She also wanted to control or to maintain a well-controlled A1C at the time of the visit. The previous result that we had at that time, it was A1C in 7.1. She was under control, and she was taking metformin. She was going to continue with the same medication with the same dose. The dose the patient was taking at that moment for metformin was 500 milligrams once a day. She was going to continue with that. My recommendation was to increase the exercise that she usually do. She said that she walks around the park like once a week. I recommended to her to increase that exercise at least 3 times a week, 30 minutes walking around the park. And her hypothyroidism, we didn't have any value, any TSH, T3, T4 value in the system, probably because we were like changing from one software to another one. We were changing from Epic to Athena, and that's why maybe we didn't have that at that time. But according to my preceptor, to the doctor, the patient is well under control with her hypothyroidism condition. So she was going to continue with her medication. Patient was taking levothyroxine, 75 micrograms once a day. So her goals will be continue with the same medications and continue to have the 3 chronic conditions under control. Patient is having appointments with ophthalmologists, with podiatrists once a year, with cardiologists once a year, and all the follow-ups with them were okay this year. She had her colonoscopy done last year without any problems, no abnormal findings on the colonoscopy, so she was doing good on that. Vaccines, patient is up to date with all the vaccines: flu vaccine, pneumonia vaccine, Prevnar 13, PPV 23. So everything was good with her at that moment. Right now, her goals for the medical topic or the medical team for her will be to continue with the same medications, to increase the exercise, to decrease the intake of salt, to decrease the intake of fatty food or fried food. She's going to increase the intake of vegetables and fruits and salads. And she was going to continue with her follow-ups. That was the medical goals. One more thing about her, she had a mammogram done 2 years ago without any problem. At the time of the visit, I gave a referral to repeat the mammogram, even though it was negative, no abnormal finding. She wanted to have another one done this year. Her OBGYN exam was without any problems, was good. It was done on January of 2020. Regarding her advanced directives goals, the patient came up with a goal that within 1 month she was going to bring all the documentations to us so we can upload it to the system. Regarding her CPR decision, patient, first of all, she decided that her healthcare proxy will be her son. So she just need to talk to him and sign the documentation with him. She said that she's going to bring that documentation within a month. Also, after the discussion, she decided to be a full code if she needed to be intubated or if she needed to be resuscitated. She wanted to have those measures for her. In case of dialysis, she said that in case of any of her kidneys or her kidney function start decreasing, and if dialysis is needed, she said that she accepts those measures regarding her health. Also about blood transfusion. Right now, at the moment of the consult, at the moment of the visit, the patient was having a hemoglobin level within normal limits, but I explained to her if the hemoglobin level drops under 7, usually we recommend a blood transfusion. She accepted that. She said that for her that's fine. If she needed, she will get it. About the artificial nutrition, also she said that if she needed, she wanted to get it. She would make that those decisions on paper. She will sign all the documentation. I provided the 5 wishes documentation, and she was going to take those documentation at home to discuss that information with her son and also with her husband. About hydration, she accept all of those measures. Surgery, if she need anything, she accept to have any surgery of any type. I explained to her, or I emphasized to her, that information needs to be discussed also with her healthcare proxy in case that she cannot make any decision in the future. The healthcare proxy will decide for her. She said that she's willing to accept any kind of diagnostic test, any type of medication regarding her health status. She wanted to have all the measures to be safe, to be alive. And for the last part of this project, I want to talk about the palliative performance scale for this patient. This scale is a validated and reliable tool used to assess the patient functional performance and to determine progression towards end of life. In this case of my patient that is 67 years old, that is a female patient, and after I assessed her and after I interviewed her, I came out with the definition or with the conclusion or with the classification that this patient is classified as a stable patient. The PPS level for this patient will be 90%. Ambulation for this patient is full. Patient activity, patient is having a normal activity and work. Some evidence of the disease in what example? For example, when she usually was having or is having any problem in regard to the sugar level, she start going to the bathroom very often. She increased her urination. That's the only change that she has. That's why I classify this patient as a 90%. Ambulation full. Activity or evidence of disease will be normal activity and work. Some evidence of disease. Self-care, patient is 100%. She's self-care. The intake is normal and the conscious level is full conscious level. In regarding of Karnofsky Performance Status Scale, this Karnofsky Performance Scale Index is an assessment tool for functional impairment. In this patient, again, patient is classified as 90%. Patient is able to carry on normal activities and to work. No special care need for this patient. Patient is able to carry on normal activity, minor sign of symptoms of disease. That is why, and after all the discussion I made with the patient, and after all the information I provided to you through this video, I came up with the conclusion that this patient is fully capable to make healthcare decisions. Thank you so much for listening to what I have to talk about this patient, and have a wonderful day.